Hello, my name is Jessica Ivers. Today I'll be giving a presentation about lead poisoning from home-prepared Indian spices in 3 families. I am a general pediatrician at the Polyclinic, and I will be the presenter. Contributors to the presentation also include Shirley Tan, who is a toxicologist at Environmental Health Services. Throughout this presentation, we're going to work to understand and define lead poisoning. We're going to learn about sources of lead, some expected and some unexpected, and we'll learn about the importance of clinical suspicion and testing. We will be moving through 3 case studies and stopping for teaching points along the way. I have no disclosures and no conflicts of interest. The first family we're going to talk about I met in March 2020. This was the beginning of the COVID-19 pandemic, and we were all focused on that. When this family came in, they brought their 3-year-old son to me for a well checkup. They had come from northern India about 5 months before from the state of Uttar Pradesh. They were concerned about language delay quite a lot, and they also talked about his chronic constipation. At that point, in thinking about what to do next, there was a lot to go on here, and fortunately I did obtain a lead level. And so in March, when I first met this patient, the lead level was 10. And so this was elevated, 5 is the reference level. And public health was notified, but we didn't do a home visit because public health was sort of underwater with everything that was going on with the pandemic, and we assumed that we would see improvement since the family had recently come from northern India. So I had planned to follow them, and I saw this patient back in June. And at that point, the lead level had actually went up to 11. So I became very concerned then. Fortunately, public health was on it, and they were able to do a home visit, I think, within days. Through help from public health, we discovered that turmeric was the likely source, and there was 1,100 parts per million of lead in the turmeric. And garam marsala, which actually also contains turmeric, had 120 parts per million. And turmeric is used daily in this household, so it's not surprising that they had elevated levels. And if we pause back to the slide before, you might notice that we also obtained lead levels for the mother and father, and the mom had a level of 7, and the dad had a level of 13. So the whole family was elevated. So what we did next, we had to get more history and kind of understand what was going on with these spices, where were they coming from, because this actually shocked me quite a bit. In speaking with the family, they told me how special these spices were because they were prepared in the home of the paternal grandmother back in Uttar Pradesh in India. The mom said that in her circle and through the media years ago, she had heard that spices could potentially be contaminated. And this was sort of well known in her area. And so many of her friends and family members were preparing their spices at home to prevent contamination. And she said to be pure are the words that she used. Fortunately, her extended family was very receptive to this concept that the spices were in fact contaminated, and they did stop using them immediately once we discovered this. So talking to the family more about what's the preparation like on these spices, how is this happening? The mom told me that the spices were purchased at a vegetable market in their city. The turmeric looked dull yellow color. They would wash the spices outside, or they would wash them with tap water and then dry them outside. And then they would bring them to a millstone at a local shop and have the spices ground. The family really didn't know where the contamination was coming from. They commented that they didn't live next to factories or large roadways. They are from a small town. And they theorized that the spices were getting contaminated somehow during the irrigation process. So they thought that the raw spices were the actual source. And again, they were motivated to prepare these spices at home to avoid contamination, which is sort of the ironic part of this case. So in moving forward, we had to get this patient treated right away. And so the first thing that we do when we're treating lead poisoning is to eliminate the source. So fortunately, we were able to identify that, and the family was very compliant in eliminating the spices, even in spite of the fact that they were special. This patient was then diagnosed with autism in July of 2020 and started applied behavioral analysis, or ABA therapy. And we did follow-up lead levels to confirm that things were getting better. So in August, his lead level was 8, and in November, it had come down to 6. So this family has been very involved in his development and in his therapy, and they do feel like he's making a lot of developmental improvements. So that's been great. So what is lead poisoning, and how do we know it when we see it? So there is actually no safe level of lead. So that might be something that people aren't familiar with. The CDC uses a blood lead reference value of 5 microliters per deciliter. And that's based on some evidence from the NANES study between 2007 and 2010, where a small percentage of kids had blood levels above 5. However, we know that probably even small amounts of elevation in blood lead levels actually do have detrimental effects, especially on things like IQ. So this is where I'd like to talk about the prevention paradox. And what this is referencing is a discussion sort of about how when lead is partially elevated, or the amount of IQ points lost for a small elevation in lead is greater at the lower end of the spectrum. For example, if a lead level goes up between 5 and 6, the amount of IQ lost for that point of elevation is greater in the spectrum of 5 to 6 than it would be going from 16 to 17. Furthermore, lead levels tend to peak around age 24 months, and so it's important to be aware of that when we're testing kids. If we test only at 12 months, we may miss a handful of kids who would have presented later. So knowing the sources of lead poisoning is very important as a clinician. Families sometimes will be able to tell you or have concerns about lead, but most of the time it's the clinician that really needs to be aware of it and ask families. So when we're thinking about where we would find lead, I think most people are aware that lead-based paint is an issue. And most of the lead-based paint that we're seeing is in homes built before 1950. However, it was used a little bit after that as well. But we can also see that paint kind of chipping off and getting into the soil. Kids can also access it through dust. So a toddler playing on the floor, if there's little bits of dust in the air, can actually have lead exposure through that means. Water is another way that we know we can have lead exposure. We saw that in Flint. And that's sometimes through corrosion of pipes or other sources. Leaded gasoline used to be a fairly major contributor. And then fortunately, in January of 1996, the Clean Air Act banned use of leaded gasoline in most vehicles. And so that has improved it significantly. You can find lead sometimes in different hobbies, such as stained glass and pottery. Now, in working with my patients, I have a few people who are artists, and I've asked them these questions. Most of them have told me that their supplies do not contain lead, and they were certain of it. But it's something to actually be aware of and talk to families about. Obviously, now we've seen spices can contain lead. It's been known to actually be maybe in toys or some of the paint on toys, especially maybe that's sourced outside the US. Jewelry can actually be a source of lead as well. And if you see in this image here, this is a picture of an amulet that was referenced in an article from a patient from Cambodia. She was wearing this amulet and her lead levels were quite high. And then eventually they sourced the lead to this amulet and her lead levels went down significantly. And if you see on the picture where there are arrows pointing at these beads, those are all lead. And so that can actually be absorbed transdermally. So that's the problem. Makeup and ceremonial powders are maybe less well-known sources of lead as well. We're going to discuss how Sindoor, which is a ceremonial or a makeup powder that some people will use from India, also Kajal and Bindi, and we'll have pictures of those coming up. Actually, we'll fast forward and just take a look now. If you see here, This picture right in the middle in this beautiful jeweled cup is actually Sindor. And in some cases, it has been known to be contaminated with lead. And then the beautiful Indian woman next to the image, you can see she's got her face painted as well as her fingers. That's Sindor as well. And then the baby in the lower left corner, you can see she has some eyeliner type on her lower lids, and she's also got a little bit of a black dot on her forehead as well. That's kajal, and that's been used in India. It's actually in Afghanistan sometimes as well, and I've heard of it being used in Nigeria. There are different names for it, so you can never really just say one name and expect families to understand. But that has been associated with lead poisoning as well. And then if you look over to the right, you see all these beautiful colors, those powders. That's bindi, and again, that's Indian. And that's kind of a makeup that people use, and that's been known to be contaminated. In the center, we've got turmeric, which, as we know, can be contaminated, and then the spices. Candy from Mexico has been known to have some contamination. There is cookware. That can be an issue as well. I know we've done some studies in Seattle specifically where they found some cookware specifically from Afghanistan that has been contaminated. And then homeopathic medicines are a little bit suspicious and should be tested if your families are using those. Okay, so the second family we're going to talk about presented to me in June 20, or actually in the winter of 2020, and he was a new patient. He was 18 months and he was transferring from another provider. This baby was born in the U.S., but his family had emigrated from Madhya Pradesh in India, and the parents' concerns were language delay and poor oral intake of solid food. He was mostly breastfeeding, and he was very sensitive to textures. He wasn't very excited about solids, and I felt like it was a bit outside the normal range. Parents also brought up constipation as a concern. So in thinking about him, and I think in some ways because I'd had this previous experience with the other family, I was like, we definitely need to get a lead level on this kid. I checked in his history. He hadn't been tested before. So at 18 months, I did a capillary lead level, and that was in January of 2020, and that number was 4.4. And if you recall, the reference range for lead poisoning is 5, and so 4.4 didn't qualify for technical lead poisoning, but it was sort of a red flag to me because it was higher than most of the other tests that I had done. So we got him set up with speech therapy, we got him into occupational therapy, and that was all good. And then I saw him again at age 2. And I thought, you know what, let's recheck your levels. I thought we'll just do a venous level of the lead just to make sure we get the right answer. And so his venous level at that point was 9.6. And I was like, what? That's crazy. The parents were totally shocked. They didn't expect it at all. They had no idea what the source could be. At that point, I checked for iron deficiency anemia as well, and he was anemic. His ferritin, which is a measure of your iron stores, that number was only 6. And normal would be somewhere between maybe 15 to 50. Other family members were tested as well. The mom had her lead level tested, and that was 9. And then you can see right here that this family came from central India, and that's sort of right next door to our first family. So what did we do next? Again, we started him in therapy and kind of got that going. And then at 2, when we realized that his lead level was certainly above the reference level, we got public health involved. They were able to quickly identify a source, and again, it was determined to be the turmeric, and that had 390 parts per million of lead. And dry mango powder was really high. That was 1,200 parts per million. People were very impressed with that number. In speaking with the family, they were shocked because these spices were so special, they couldn't imagine how they could be contaminated. It took them a while until public health actually came out to the house and really spoke with them that they were really willing to accept that this was going on. It turns out these spices had been prepared in the home of the paternal grandmother, and she also lived in what she defined as a small town. This family was a little bit different in the fact that they didn't know that spices could be contaminated. So nobody really in their community talked about spice contamination. Nobody was worried about it. Testing for lead levels wasn't even something that many people were aware of or was even possible in their contacts in India. So in speaking with the mom a little bit more about spice preparation, she said that they would purchase the raw materials at the open market, in an open air market, and they would buy dried up fingers of turmeric, and they would just purchase dried bits of mango, and they would wash them with tap water, and then they would dry them on the rooftop. And the family does suspect that the contamination was probably happening during this drying process. They said that they don't live near factories, but they feel that their area is a bit polluted, and so that's what they believe is the source. These spices then were brought to a millstone, which again was a community millstone, and they were powdered. And unfortunately, in this family, we have not been able to convince the extended family to stop using the spices. And so the last I spoke with this family a few months ago, all of the extended family was still using them. This includes women, possibly pregnant women, nursing women, and kids. And so we're hoping still to be able to make an impact going further on that. So in terms of treating this patient, again, we removed the spices from the home. This family was receptive to doing that, and they were very compliant. We did follow-up testing, and 4 months after diagnosis, this patient's lead level had come down to 4. So we made excellent progress there in a short time. He made a ton of progress with his speech. And so when I saw him at about 28 months, the family had been dismissed from speech therapy. They felt like he was combining words, his vocabulary had increased. So I could visibly see they were less stressed. And he was still getting some help with his eating and some of his textural sensitivities, but he had made great progress. The mom had completely stopped breastfeeding, and he was eating mostly big kid food. So you can see we've got some pictures of some other kids from India here. So I think, a big question here is, why are the spices contaminated? Like what's going on? Why would somebody do that? That doesn't make any sense. And the answer is probably will become apparent as we talk a little bit more. In the top corner here, in the top right corner, you can see that beautiful yellow powder. That's actually lead chromate. That is pure lead. It is not a food, it is lead. And so when you see how beautiful that is, you can imagine there's a lot of uses for it. And we think about turmeric, that root, which is yellow and maybe orange. You could possibly use that to enhance the color, but you can also understand why it's been used in makeup and paint and other things. So lead chromate has been known to enhance color and also potentially enhance the profitability of spices, just secondary to the factor that it can increase the weight. People may view turmeric as higher quality if it does have that yellow color. And spices in general are more commonly adulterated or changed because they're expensive and they're processed before sale. So that opportunity exists. My collaborator, Shirley Tan, also has become concerned about the millstones. If you've heard me discuss through the lecture, each of these families is grinding these spices at millstones that are located somewhere in the community. And so it's possible that some of the, there's something in those grinders that maybe has been smelt with lead. I have a picture here of what I think the millstones might look like. We're actually working with the families to try and get more pictures of these millstones to try and understand this better. There's some data that says that flour has been contaminated with lead secondary to millstones, and that has been documented mostly in the West Bank and in Palestine. We have an article from El Sharif from 2013, and then also an article from 1985 from the Eisenberg. Finally, our third family. I actually didn't think I was going to have a third family to talk about, and then lo and behold, a family came out of the woodwork just a couple months ago. So this family emigrated from Andhra Pradesh, which is in southern India, and you can see the picture here. And I've known this patient actually since she was born. She's 15 months old when I saw her recently in May. And she came in for her well checkup. Her parents have no concerns about her development. She's saying about 2 or 3 words. She's working on her understanding. She's walking. She's doing all of that. But the family was really adamant about testing for lead. So I have actually been talking to them about how they have to watch out for spices, and they've been telling me that they buy all their spices here in the Indian grocery store, so they weren't too worried about it. But at 15 months, they really wanted her tested. At 12 months, I would have liked to have tested her, but unfortunately, our supplies were a little bit low, and so we were unable to at 12. So at 15 months, she came in and we did the lead test. And I was shocked when her capillary lead level came back at 16. So I was hoping that it was a false positive. I got a confirmatory venous level, and that number came back the same. And so just one note on false positives. It's very common in my experience that you could obtain a false positive from a capillary lead level. And I have found this test to be more challenging than it would outwardly appear. So what's happening is when we're doing a capillary lead level, my assistant will do a small finger prick and attempt to get blood from the patient and then put it into a little point of care machine in our clinic. And it's great if we can get the result back in a couple of minutes. The problem is we experience contamination if the child touches even a paper towel in the room. And so if you don't have a consistent assistant who's well-versed in the process, it can be very awkward. So what we do is we scrub the finger and then with just plain water and then let it air dry for 2 minutes. But if the child is running around playing, there's always a chance that something can happen. And so I have found this test to actually be somewhat operator dependent, and an experienced assistant is much less likely to get false positives. So every elevated test has to be confirmed with a venous level. So that's the challenge. So anyways, back to our case. So she truly did have an elevated lead level, and we became very concerned right away. I encouraged the mother and the father to both get their lead levels tested. The mom was still breastfeeding quite a bit, and so I really wanted to know what her level was. And I also wanted to make sure she was not pregnant, which she confirmed she was not. So mom's level was 20 and dad's level was 26. So they were very high. So we were able to get public health to come out and do a home visit, which was great. And in these cases, we determined that, again, the sources were spices. So the turmeric had 16,000 parts per million, and they were using this about twice per week. Now, initially, the family told me they'd been got these spices from the Indian grocery store. But on further discussions and working with public health, they actually did disclose that the spices had actually been prepared back in India and hand carried. So turmeric was the one spice that they were getting from back at home in India. Red bindi, which again we talked about earlier what bindi is, it's that red powder, that also was contaminated at 1,700 parts per million. Mom and dad said that they were only using this once or twice a year, so that seemed to be a less likely contributor. I also felt like likely the turmeric was the issue because the father was so affected, and so they were all eating the family food. We're still actually waiting for some results in this case. In this case, this infant was actually wearing some kajal when I saw her, so she had a red or a black dot on her forehead. These are still being tested, and so we don't know those results yet. But fortunately, I'm quite confident that we actually did get the source, because if you go to the next page, her lead level came down after 2 weeks to 10.6. So we stopped using all the kajal, we stopped the spices, and so I was really happy we were able to get her lead level down so fast. So speaking a little bit more to the mom about where these spices were prepared, she said it was prepared, the mom said it was prepared in her home by her mother in Andhra Pradesh. And this has been done for generations. So this is very much a traditional thing. The red bindi they obtained in an unknown temple in India, so we're not able to trace that at all. We'll take a brief moment just to take a look at this picture. That's actually a field of turmeric growing. And so turmeric is grown quite a lot in India, and so it's a crop that is prevalent there. So this family has been purchasing the turmeric in just a grocery market. So they felt like it was just a normal market in their city. They don't feel like their city was necessarily a small town or it's a kind of a normal sized city is what they said. They were washing it with tap water and then drying it on the terrace. And then they're grinding it again at a local community grinder. They have not had any guesses as to how contamination occurred. But fortunately, they haven't had any issues with getting their extended family to stop using the spices. So they've been very accepting that these spices are contaminated and that they need to do something different with the spices. So that part has been good. And one of the reasons that I keep bringing up small town versus big town is that in my first two families from northern India, northern central India, one of the things that both of the mothers kept telling me is how doing these home preparations of spices is very common in small towns. So it's sort of a cultural identity of the small towns. And they were kind of talking about how big city people don't, one of the moms said big city people don't have time to prepare the spices at home. And this is sort of one of the special things that they did because they work from more rural communities. And again, it was also common amongst their friend groups. So again, in terms of treating this patient, we were very comprehensive in terms of counseling the family on things to eliminate, including the spices, the bindi, the kajal. The baby was actually wearing a bracelet and she stopped wearing that as well. And then again, we're pretty confident we got the source because the levels are down to 10.6. So once we have all the tests back, we're going to be able to give the family the opportunity to start using those things that we took away, because obviously these are important to the family. We don't want to just say you can't use those forever. We want them to be able to live, in accordance with their culture. We started giving this infant a multivitamin with iron. We confirmed she did not have significant iron or real iron deficiency, but we did that, and I just counseled them quite a lot on healthy diet with lots of fresh fruits and vegetables, and trying to eat solid foods. The family continues to feel she's doing well developmentally. I offered some developmental screenings, but they actually felt like that wasn't necessary, and they're very involved and spend a lot of time with her, stimulating her. Okay, well, I think that brings us to the end of our discussion. So we've talked about 3 different cases over a period of about 14 months where we've seen elevated levels of lead in patients who were consuming spices that were hand prepared in India, and then either mailed or carried here from there. And so I think it really just highlights the fact that there may be more cases that we're missing, and I think this is something we need to be talking to families about. So I think the conclusions here would be that if we're going to find lead, we have to suspect it and we must test for it. We can't always count on families to suggest lead testing. Most of the time, families have a hard time believing that anything they're eating or using could possibly be contaminated, especially if it's something as special as spices, makeup, jewelry, toys. Those are special items. We may have a trend here, and I think we need to look at it further. And so we need to learn more about where these spices are getting contaminated, how that process is happening, and what we can do to prevent it before it occurs. And this is obviously a risk to our patients, not only here in the US, but it's also highly relevant for all the people living in India and other parts of the world. Okay, and that concludes my presentation. It's been wonderful being here today and sharing my stories and the stories of my families with you guys. I do have some acknowledgements. I'd like to thank Shirley Tan, my collaborator. I'd like to thank my assistant, David, who has done all of this lead testing for me, and it has been painstaking, and he never complains about it. So I want to give him a big thank you. And also Sherry Zorn, who is another doctor within my practice. She championed lead testing at the Polyclinic a few years ago, and so we've increased our numbers quite a lot. And then finally, I'd like to give a thank you to all of the anonymous families who have been receptive to this diagnosis and have been willing to pass that information on to their family and friends. And I think we're all learning from it, and we'll hopefully be able to help others. So, okay, that concludes my presentation. Thank you.